Welcome everybody to the sixth and final AgriFutures Thoroughbred Horses Pro this year. I'm Justin Darcy, the Media and Marketing Officer at Thoroughbred Breeders Victoria, and joining me tonight is Annelies McGaw from AgriFutures. She's the Program Manager. Dr. Lyndal Hulse from the University of Queensland, Shaunna McTernan from Charles University, and Dr. Martina Jelocnik from the University of Sunshine Coast. If anyone has any questions at all tonight while our special guests are speaking, please just raise your hand, and we'll just hold them until the end of each person's presentation, or just feel free to ask them in the chat, and Annelies and I will monitor those. And without further ado, I'll hand it over to Annelies.
Excellent. Thanks very much, Justin. This is the sixth one of our webinars, and we really appreciate TBV coming along and helping us out with these presentations. So as Justin noted, we have got here today a couple of presentations to talk about. But I'll just be going through a quick overview of the Thoroughbred Horses Levy and the program, and also where we're up to with the research and development plan. For those of you who have been participating in previous webinars, you will know that we've been developing a new 5-year plan for the program. So then we'll have Dr. Lyndal Hulse talking about Hendra and the associated quick test that we're developing with Dr. Hulse. We'll then have Shaunna from Charles University talking about salmonella and its prevalence in Australia. And then Dr. Jelocnik from the University of the Sunshine Coast talking about chlamydia, herpes and strangles quick tests. So for those of you who don't know about the Thoroughbred Horses Levy, we pay $10 from every mare returned paid by the mare owner, and then $10 for every mare served paid by the stallion owner. That is then matched by the Australian government for all the research and development spend at 50 cents for every dollar. And so we have a program spend of about $1 million each year into research and development on behalf of thoroughbred breeders. We have currently 24 ongoing projects, and our previous key achievements are management for the heat stress in stallions. We've done a quick test for chlamydia and herpes, which Dr. Jelocnik will be talking about today. We've also developed a sperm fertility assessment device for stallions, and we also provide industry support in terms of fast track applicants. We have a Horizon Scholar, and we also provide other support through sponsorship of, for example, we sponsored a section, the clinical paper section at the recent Bain Fallon conference earlier this year. For those who are interested in our research and development that we have here at AgriFutures Australia, we have the annual snapshot. We develop an annual snapshot, and which is just pictured there on the right-hand side of your screen. I'll put the link in shortly for you to be able to access that snapshot. So just briefly, I just really briefly wanted to go over where we're up to with the next Thoroughbred Horses program research and development plan for 2022 to 2027. We have gone through a development process earlier this year with the Thoroughbred Horses Advisory Panel and a number of key stakeholders. We then put the plan out to consultation, which at the last webinar I was talking about the consultation. And thanks very much to anybody who provided feedback. It was fantastic, the feedback we got. And so based on that, we have decided to focus on 4 particular priorities, which is a change from what went out over public consultation. So now we'll have thoroughbred horse welfare, workforce safety and environmental sustainability. Priority 2 is thoroughbred breeding efficiency. 3 is workforce, industry and community engagement. And then finally, thoroughbred diseases and parasites. And our overall goal is to improve the sustainability, productivity and competitiveness of the Australian thoroughbred industry. So we are hoping to take that to the AgriFutures board in the beginning of next month for endorsement. and then implement that in December for 2023. So it's been a very exciting process, and I really appreciate anybody who has participated.
So our project is on Salmonella and its prevalence in the thoroughbred breeding industry. I guess a little bit about Salmonella. It's a highly infectious gastrointestinal pathogen with multiple species within that genus, and it is responsible for a spectrum of disease that we see in our patients. It can be anything from a fever to inappetence and obviously profuse diarrhea. It's seen in adults and foals. In foals, it's seen as sepsis, septic arthritis, and osteomyelitis, all of which can have detrimental effects for future performance. Over the last 20 years, we have seen increasing reports of Salmonella. It has resulted in large equine hospitals closing for decontamination. The benefit of these outbreaks is that we actually have found out a lot more information about how Salmonella behaves. We've managed to identify Salmonella shedding populations, which are actually asymptomatic animals. Oftentimes these animals are sick with colic or systemic inflammatory response syndrome, and they're considered high risk. And even more recent data has come out suggesting that the other sick horse populations are actually also at risk of shedding Salmonella, which kind of fits into the idea that all horses are capable of shedding it, and that, you know, we can't, I guess, hold any stigma against anyone for having Salmonella. Development of infectious control programs has grown in the last 20 years based on this information, and we've been able to refine our biosecurity protocols in hospital settings. The significance of Salmonella on an individual level is that obviously it causes significant morbidity and mortality. On an industry level, there's widespread environmental contamination. We can have hospital-acquired infections. We can have closures of our large equine hospitals, which significantly affects the welfare to our equine populations. There are on-farm outbreaks, which obviously causes significant ramifications, especially in the breeding season. And Salmonella is also a zoonotic disease, so we have to be mindful when looking after these animals that our staff can also become unwell. So biosecurity is paramount. The purpose of our project, in the context of Australia, we have pretty limited information, and there's no recently published reports on Salmonella. So we hoped that we will get enough information to determine the prevalence, risk factors, and an idea of antibiotic sensitivity, and hopefully better define and have a greater understanding of Salmonella within the Australian thoroughbred population. Ultimately, this will hopefully give us an idea of the impact of this effect on the healthy and hospitalised horse populations, and ultimately guide management approaches that we can implement evidence-based strategies to address on farm and in hospitals. And again, I think the main consideration is that we want greater discussion around Salmonella within thoroughbred and broader equine communities. So the project is a 2-year project. It is funded through AgriFutures, and it is part of a higher degree by research at Charles Sturt, again, focusing on prevalence, risk factors, serotypes, and the antibiotic sensitivity patterns. We hope to gather data retrospectively as well as prospectively. So looking back into previous records in hospitals, we hope to look at adults and foals presenting for gastrointestinal and severe illness. And the idea is that these samples are collected during hospitalisation as part of infectious control programs already in place. Stud farms, the sampling will be performed in healthy animals at certain time points throughout the year over a 12-month period. And in the idea that we would identify significant time points where Salmonella shedding may be increased, such as in postpartum mares. The project hoped to involve a large number of horses, hospitalised and healthy. It is a multi-centre study with cooperation and collaboration from multiple studs and hospitals throughout New South Wales and Victoria. The outputs hopefully will get enough information for it to be significant and give us an idea of the prevalence, so percentage of the population shedding salmonella at any time. It will be considered the largest study performed in Australia on salmonella. We hope to gain more information about risk factors, such as the environment influences, management, and the significance of comorbidities on salmonella shedding. I think it'll be useful to find out what species we have and whether that changes based on the area where the horses are located. And obviously, is there any evidence of resistance in that if we needed to resort to antibiotics, would we be able to use them in these cases? Representative results due to the large numbers would hopefully be able to guide management practices and allow for broader industry education. The impact of the project, I guess, focusing on animal welfare through reduced morbidity and mortality on an individual level as well as herd level. I guess, again, increased industry awareness and discussion around salmonella within equine veterinary circles and the thoroughbred breeding industries, working together in that space to try and, I guess, discuss it more openly and get a better understanding of how we can improve the welfare in that space with our horses. And ultimately as well, there'll be significant costs that we can reduce by having a greater awareness of how this pathogen plays out in our populations. And just at the end, our collaborators at this point in time, we have Scone, Bendigo and Newcastle Equine Hospital all contributing their data to try and give us our best chance of getting a representative study.
Hendrovirus, it's still a very, very relevant and very current pathogen that's still out in the environment, and we're seeing at least one horse infected per year, and the most recent case being in July this year from a horse from sort of central Queensland, on the east coast in Mackay, and it's the first one in 5 years. So it's still an ever-present danger to not only the horses but the people who are actually involved with the horses. So just a bit of a background. Flying foxes are the natural reservoir for Hendrovirus, although they do not show any signs of illness when infected. The virus is most frequently detected in bat urine, less so in blood and feces, and minimally in saliva found in masticated fruit and nasal discharge. Horses become infected with Hendrovirus when grazing below bat roosting sites, and studies have shown that there is a seasonal effect on the presence of Hendrovirus, indicating that there are environmental triggers associated with spillover effects from bats to horses. So given that urine is probably the most important route of Hendrovirus excretion, this suggests that direct exposure of horses to infectious flying fox urine may be an important transmission pathway. However, the precise way of transmission is still not known. So the clustering of flying foxes in tree canopies and subsequent exposure of many individuals to mists of aerolized urine might favour transmission routes and that do not require a long environmental survival. So detection of Hendrovirus traditionally is done in the lab. So there's a few different lab tests that are used to diagnose Hendrovirus. We have antibody detection, so ELISAs, virus neutralization tests, but molecular tests such as PCR is considered the gold standard diagnostic assay of choice for pathogens based on its reliability and its high sensitivity and specificity. However, the key disadvantage of using molecular-based tests is the restrictions to its use in research and or diagnostic labs, to undertake the sample processing and time-consuming thermocycling protocols that PCR sort of engage. These can all actually delay diagnosis. So just by chance, I was allowed out of the lab for once and ventured down to the veterinary clinic at UQ, just chatting with one of my wildlife vet mates, and Professor Ben Ahern, who was actually the chief investigator on these projects. I ran into him and we just all got chatting, talking about lamp diagnostic tests and how they can be implemented as point of care tests. And he just randomly said, do you think you could make one for Hendra? And it's like, oh, okay, we'll see what we can do. So lo and behold, we were actually able to do that. We put in an application with AgriFutures in 2020. It was successful, and this was to develop a prototype or a pilot study for developing Hendra as a point of care tool using LAMP technology. So we had quite a few collaborators that came on board. Hendra, of course, being a biosecurity level 4 pathogen, we couldn't actually just go into the lab and whip something up. So we teamed up with ACDP at CSIRO, formerly known as ARL, also BSL, the Biosecurity Lab here in Queensland, and they all have the appropriate biosecurity approved labs that we could actually do some of this work in. And we had some great, also great contributors for Equine Veterinarians Australia, and also some veterinary clinics that were very interested in participating and being available to contribute to our research. So this, being successful with our AgriFutures application, we were able to take molecular diagnostics out of the lab. So using LAMP, as you can see, there's a photo there, and I'm using LAMP in the back of my truck, being able to do molecular testing, stable side or at point of care. So LAMP is actually just a newly developed, well, it's not so new now, it's a simple gene amplification method. So one of the key advantages of LAMP is that it's simple, it's rapid. It means on-the-spot pathogen diagnosis is possible. So you can get a result within an hour of sampling an animal, testing it, and then you have an answer. Because there's so many different primers within a LAMP assay, it's highly sensitive and high sensitivity and specificity, even when there's decreased amount of target available, and it's actually able to tolerate any sort of sample inhibitors a lot better than what PCR can. So we run all our LAMP assays on specialized instrumentation called the Genie 3. It's specifically designed to operate LAMP technology. So this project in 2021, through AgriFutures, we got to a point where we'd actually finished the project. We had actually developed a test that was highly sensitive and highly specific to detecting Hendra, and probably about 3 months before we finished, the Hendra variant was discovered, but I'll get to that in a moment. So one of the main objectives of this project was to ensure that we developed a method that that is actually really safe for the veterinarian or the veterinary professionals, anyone who sort of may be taking samples or processing samples in their little in-clinic lab or something like that. So our sample preparation method we developed is a process between a heat lysis, so heating the sample, which actually kills the pathogen. So as you can see in the photo there, A and B, the figures A and B, they're actually normal cells. So we did this all through cell culture. We mimicked what would be happening in the field in regards to sample preparation. So you add a buffer to your sample, you heat that sample, and you can see A and B was a heat treated sample and there was no infection. Whereas C and D, there was no heat treatment or heat inactivation of the pathogen, and you can see how destructive Hendrovirus is to the cells. So this is all done in the lab. So we actually wanted to ensure that our method was completely safe for and inactivated the pathogen, which was very, very important. So please ignore all the numbers. This is actually part of our validation. So this is actually to test the sensitivity of Hendrovirus LAMP. So mainly the level of detection that we can detect Hendrovirus in a sample. So, and we also compared it to the sort of the gold standard, which was PCR done at BSL. And as you can see, there's no gaps in that table. So the test that we had actually developed was just as sensitive as the PCR test done in the lab. And then also specificity, we want to make sure that there's no false positives that may occur in regards to cross-reactivity with other non-target equine pathogens that may be present. So we tested the LAMP assay against a whole heap of other viruses and bacteria, and we had no cross-reactivity whatsoever. So very high specificity. And then the next step, we wanted to combine it with an internal control test to A, confirm presence of host DNA, and also to monitor any potential inhibitors of the LAMP test. So the internal control is included because having knowledge of how Hendrovirus, the developmental cycle, how it actually works in with fusing with cells, transcription in the nucleus of cells, we need to be able to guarantee that we are getting horse cells is where on the sample where actually Hendrovirus lives and replicates. So we combined that. So this is actually a lot of tests that we sort of put together. And then we got to the point, we had GeneWorks start to manufacture the LAMP kits. And you can see the little silver bags there are our Hendrovirus LAMP kits. We had a training day at the vet school just to go through our vet clinic collaborators, train them, show them how the genie works, how to prepare samples, and basically give them an overview of how it actually works. And also through this project, we purchased genies for each of our clinics that participated in the project. So as I mentioned, we got really close to the end of that project, and the Hendrovirus variant was detected. And this put a bit of a spanner in the works, and we virtually had to scrap everything we've done because we did a sequence comparison between the two sequences, the variant and the prototype, so G1, G2, and there was only 86% similarity. We ran some inactivated variant isolates that were grown at ACDP, and our LAMP test did not detect it. So it was back to the drawing board, and which brings us to our next round of funding we applied for with AgriFutures, which was successful, and this is where we're up to now. So this is Hendrovirus LAMP Development 2.0. So this project, the objectives of this project was to redesign the Hendrovirus LAMP point of care test to enable detection of both the original and variant sequence, to multiplex, so make the test more efficient, multiplex, so join all the targets, so you've got 3 targets, and be able to test that and detect it from a single sample tube. In addition to that, we're also undergoing a formal validation pathway following the World Organization for Animal Health guidelines for validation of diagnostic tests, and as recommended by the Subcommittee on Animal Health Lab Standards. So this is the lovely flowchart that Skulls sort of output as to the recommendation of how you go through your validation. So I know it's probably making your retinas bleed at the moment, so I do apologise. But in short, we have sort of formulated. This is going to take a bit of a team to put together. We've got a research team which has expanded, and we have also formulated a steering committee to help guide us with the validation tests. So this is in collaboration with DAF here in Queensland, ACDP, the Federal Department of Agriculture, EMAI, and Equine Veterinarians Australia. So, and again, Professor Ben Ahern is the chief investigator on this project, and unfortunately he couldn't be here with us today, but hopefully we're onto stage one, nearly completion of stage one of the validation process, and things are looking good at the moment, so very promising. So thank you very much.
Here we go. Okay, so this is from Maria Lopez Peralta, I think it's pronounced. Thank you for your presentation, Dr. Hulse. May I ask, how many samples did you test? And was it only tested in Queensland, or did you try other states as well?
Well, part of the SCALS validation is a recommended number of samples to make sure your validation is actually powerful enough. And this is called the diagnostic, what is it? I actually wrote it here somewhere. So validate diagnostic characteristics. So we diagnostic sensitivity and specificity of the test. So there is actually a recommended number of samples. SCALS do give an outline of, the criteria that must be met in regards to testing, which includes sample number for validation of the test. So yes, there is a certain number. I can't think of it offhand because there's a lot of them for the different stages. So, and there's repeatability and inter and intra repeatability, and yeah, so yeah.
Lyndal, just to draw that out a little bit more, does that mean that you have to use samples from all over Australia, or is it just samples because they're stored at the biosecurity labs, aren't they?
Yes, this is where the ACDP comes into play. They're actually doing all the diagnostic sensitivity for us because we can't do it. We don't have the appropriate biosecurity level labs here. So they're kind enough to do all that. So they're playing a very big role in this project.
Well, first of all, thank you for inviting me to present this research. My research, well, first of all, my name is Martina Jelocnik. I'm from University of the Sunshine Coast, and I also work on development of rapid isothermal assays for detection of range of equine pathogens, so chlamydia, equine herpes virus, and in this new project supported by AgriFutures, we want to look at streptococcus, which is a causative agent of strangles. So, of course, my favorite organism is chlamydia, and it was very exciting that I was able to work on the first cases of chlamydia abortions in horses. That those projects were also supported by AgriFuture, and that is how we got the idea that at some point we also need rapid tests for chlamydia. So chlamydia, as you know, continues to cause equine abortions every year. And in this presentation, I will actually outline some of the examples how we translated what we do into the lab at the point of care. Of course, we also looked at equine herpes virus because equine herpes virus is very economically important and highly prevalent, and sometimes may cause the same clinical manifestations and chlamydia. I, of course, don't have to tell you about the equine streptococci and in particular strangles. strangles. It's one of probably the most contagious pathogens of horses, and as you can see, can cause severe disease in horses. So as Lyndal said, we have variety of gold standard qPCR diagnostics options. So these options, they are commonly available in veterinary diagnostic lab, research lab. However, they all need equipment. You have to be a little bit trained. And, you know, sometimes when you want to diagnose, you do gotta pay for that test, and you might even wait up to several days, maybe sometimes even more than a week. Thereby, we do like the rapid point of care diagnostics. And it was interesting enough that although the research is saying there is so many options, these point of care diagnostics are still not so commonly used, not just in equine industry, but also in other industries. Some of them, again, can be also costly. You would need a specific instrument. Some of them, at the end of the day, are not actually so point of care. But in particular, veterinary point of care testing is very attractive, and it is a good option when, in case of psittaci, we had a big episodic in the Hunter Valley where more than 20% of abortions were because of chlamydia. And chlamydia, it's also zoonotic, can infect humans and cause pulmonary respiratory infections. And of course, particularly like Lyndal said, with Hendra, as well as some other pathogens, it's the biosecurity. So we want to know what we are dealing with so we could implement some of the measures. And of course, among the rapid testing, there is a sea of methods. There is a sea of point of care proposed. Some of them are antigen-based. A lot of them, they do propose DNA or nucleic acid detection using isothermal amplification. And then, even within the isothermal amplification, we have a sea of methods and options. However, LAMP is emerging to be one of the more popular ones because it is highly specific. We use a lot of primers. You could use simple equipment such as heating block and then see your result just by eye, or you could use instruments such as real-time fluorometers, so-called genies, which are very easy to use, easy to interpret, and yes, you could set them in a clinical setting. So the isothermal diagnostics for some of the horse pathogens are actually not new. Equine herpes virus was proposed even in mid-2000s. Equine streps were proposed since 2017, and we were also the first ones to propose for chlamydia psittaci. Also done very similar to Lyndal. We were inspired by the isothermal assays that we did for the koala, and then we thought, okay, well, by then we knew that we had chlamydial abortions. Well, why don't we apply this to the horses? So when we develop these assays, so exactly like Lyndal said, so us in the lab, you know, we have a lot of instruments, we know it works. Sometimes we can do little tips and tricks. And then when it comes to the point of care, a lot of these assays, they simply don't work or there are some problems. So the first question, the first notion with us, it's always, can we effectively and confidently use our developed lamp at the point of care, not by us, yet by the operator. For example, let's say a technician in the veterinary lab, perhaps a vet nurse, attending veterinarian, and or similar. And in order to answer this effectively, we also check our genes, we validate against reference diagnostic assays, for example, those that they are run in New South Wales DPI or IDEX or other veterinary diagnostic labs. Then we, of course, evaluate this assay by testing real-world clinical samples. So, for example, in my case, there would be placental swabs, vaginal swabs, nasal swabs. guttural pouch, oropharyngeal secretions, etc. And which is really, really important is that we provide easy to follow and very clear instructions to our end users. And we also need to provide the troubleshooting tips. So if something doesn't go wrong, that the end user would know how to fix. And as a part of our chlamydia and equine herpes virus, we also did all that in the lab, and then we went into the equine hospital laboratory to apply this at the point of care in clinical setting. So in here, this is just like a little flow chart, what we actually do, and after we apply these assays at the POC, we actually come back and compare to everything to the gold standard, which is the qPCR. So as Lyndal said, so we also use this particular instrument called Genie, because Genie, it's an enclosed system. You can see the real-time amplification, meaning potentially there is the targeted DNA of the pathogen, which is further validated by a melt. And quite often we do get asked, oh, but could I do this without Genie? You could. And yes, you still would need some of the equipment, like heating blocks, maybe a little vortex, maybe a little centrifuge. And then our second biggest question is, okay, I don't have facility to perform full-on DNA extraction like it is done in the diagnostics lab. So could we do this with a rapidly processed sample? In our case, we would use swabs and, or as I said, guttural pouch or oronasal pharyngeal secretions, etc. And yes, we absolutely could. So we too use very simple heat lysing and LAMP. It's pretty robust on the crudely processed DNA. However, in some instances, we always say to the end user, yes, some inhibition can occur, and potentially we could miss very low load samples, like if there is just 1 to 10 copies of chlamydia or equine herpes virus. Whereas qPCR done in the diagnostic lab could pick up those low load asymptomatic infections. So as I said, so after we did all that in our lab, we were confident in what we had, and then we went to the actual point of care. And at the actual point of care, we asked the technician with no prior molecular experience and the one with little bit of molecular experience to perform these assays. So we kept it very simple. Our clinical swabs would be just shaken off in a water, heat lysed, and we could use the swab suspension to test in the lamp. So in lab, of course, we tested over 100 samples, but at that time, at the point of care, we had incoming fresh as well as frozen 34. And later on, because of COVID, we had a very smaller trial testing samples. But I do know that the technicians at the lab now, because they do have the Genie instrument, they test when they suspect they could be a chlamydia, for example. Of course, there is a little bit of a setup needed, and beyond the Genie, we do recommend something like a heating block, maybe a vortex, and centrifuge can be simply replenished with something like a fidget spinner. But I do also want to pinpoint that after we have tested it and performed initial point of care testing at the veterinary diagnostic lab, we perhaps the case that happened last year was the best to illustrate why a lab, if possible, should acquire something like Genie. So beyond testing for Hendra, we now have assays for chlamydia, equine herpes virus, and we are developing for strangle. So for example, on this particular stud, we had chlamydial abortions. So they would happen in June. Although the mare could be seemingly healthy, swabs were taken, sent to New South Wales DPI for diagnostic testing. We waited 7 days for the results to come back. Another mare aborted. Again, 7+ days until we got the diagnostics. So at that time, the farm decided, okay, well, maybe we should buy Genie. So we worked with them, we helped the setup, we provided training materials. And then when the next abortion happens, the farm was able to determine within 1 day that yes, indeed, we have chlamydia. We still nevertheless sent through the samples to the diagnostic lab for the definite confirmation. And after 7+ days, we had 100% congruent results of what we tested on the farm to what was tested in the diagnostic lab. So swab taking was very easy. And also with the positive results, the stud team was able to implement their own protection and biosecurity measures because chlamydia can infect humans. However, lumps are very good, they are very promising, and we absolutely need to acknowledge that they are not perfect as yet. So they are very sensitive, they are very specific, and if a stud has a Genie instrument, we can now increase and provide a panel for a couple of different pathogens. It's very promising as ancillary testing because there is a high confidence of use, ease of use, and good congruence with the gold standard qPCR testing. However, we also need to point that the Genie instrument and other equipment are still needed. This may lead to higher costs. And I guess we also now have a challenge that what other real point of care options could we provide? Could our next development focus on microfluidic device and real point of care testing, just like we did with COVID? And further, we also want to improve the DNA extraction that can be done at the point of care, so we really pick up the targeted pathogens. So we still have a little bit of work to do. And of course, it's always a big team. It's never us alone. So we are very lucky that we also got supported by AgriFutures and a lot of equine groups across the country. Thank you.